Welcome to anybody who's coming in here. We'll wait a couple of minutes and allow folks to filter in. I'll introduce myself now and probably right before we get started. So I'm Adam Schmitt, Dr. Schmitt. I am a dermatologist and Mohs surgeon at Zel Skin Laser here in, I go to the Edina office and Plymouth office in Minnesota. Did my training at Mayo Clinic in both dermatology and did a fellowship in Mohs surgery. And before that did my medical school at Case Western in Cleveland Clinic, and did a master's in epidemiology and public health at the Harvard School of Public Health. So that's my background. Do you want to say hi, Melanie?
Hi, I'm Melanie. I'm the office manager here at Edina, and we have a lot of skincare products. We have a lot of sunscreens and other products that can help you with sun protection. So I'll be answering some of your sunscreen skincare product questions at the end of Dr. Schmitt's webinar.
She is the expert on that. Wait a couple more minutes here. Again, welcome to folks as they filter in. Hopefully you're staying dry today. I think it's kind of clearing up. And I apologize for any marks I have on my face there. I've been wearing my mask all day long as well. But we figure it would be very difficult for you to hear me and understand me if I were wearing my mask during this time. So we're distancing, but I took my mask off for the moment. A good chance for folks to make sure your audio is working just fine. You can hear me. Even if you can't hear me well during the presentation, hopefully, I tried to include enough information on the slides where you could glean the key points. Obviously I'll expand on a few of them verbally, but even if you can't hear me or understand everything, there should be some key points on there that will be helpful. And then we will have a link, I believe, to this talk afterwards, where you'd be able to watch the talk again, maybe review the slides if you need to for those key points. So it looks like we've got 20 people or so checked in, and we're almost 5 minutes into the webinar time. So I will just introduce myself one more time and then we'll get started here. So welcome everybody. Again, my name is Adam Schmitt, Dr. Schmitt, and a little bit of my background is I did my undergraduate education at Northwestern University in Chicago. I did graduate school at Harvard School of Public Health. I did my medical school at Case Western in Cleveland, time spent at Cleveland Clinic. And then I did all of my residency and my fellowship training, which was in Mohs surgery, all at Mayo Clinic. And then I'll introduce Melanie one more time before we get started here. She'll be helping us out.
Hi, I'm Melanie. I'm the office manager here at Edina, and we sell a lot of skincare products that can help you with your sun protection, a lot of sunscreens, but also some other antioxidants type products that also help protect you from the sun. So I can answer some of those questions at the end of the webinar.
All right, great. We'll get started here. So these are some sun protection tips for you, hopefully some practical tips. Also want to provide some background knowledge, what we're talking about when we talk about sun protection, what UVA and UVB are, all those things. So it's important to note I have no financial disclosures. Any of the products that I mentioned here are just products that patients have told me about or my family uses, but I'm not endorsing any specific brands specifically, just giving examples. So my objectives today are to help you understand the importance of UV protection, to describe the burden of skin cancer, describe different types of sunscreen. I'm sure you've seen different formulas and types of sunscreen out there and might have questions. I want to identify additional sun protection techniques beyond sunscreen, and then just answer questions or address questions that I get asked a lot in clinic, and hopefully provide some more information. So some background here. I want to talk about ultraviolet a little bit. So when we talk about sun protection, you'll see things that say UVA or UVB. The distinction between that is the wavelength in the UV spectrum. UVA has a longer wavelength and UVB is shorter. UVA we typically attribute to tanning and photoaging. It also does suppress the immune system, the local immune system in the skin, and does contribute to skin cancer formation. It used to be thought that UVB only led to skin cancer formation, but UVA definitely contributes to that. UVA is far more prevalent than UVB, and it's more ambient. It's just, it can go sort of sideways, under shade, things like that, whereas you might be protected from UVB, UVA can still have access there. UVB is more linked to sunburn and DNA damage and contributes very directly to skin cancer formation. That one is blocked by windows though, whereas UVA is not. And then there's UVC, which essentially doesn't reach the Earth's surface because it's filtered by the atmosphere. Here's a nice visual of that. So when you think of visible light and you start getting higher in energy of the UV and shorter in wavelength, then you get the UVA and then UVB, and again, UVC is essentially filtered by the atmosphere. This was a nice image on USERN's website that just, when people say photo aging or photo damage, what are we talking about? Talking about, whereas the skin might look relatively undamaged, when we apply certain filters, UV filters, you can see that there's a lot of underlying damage there that will start to show itself eventually. Here's a very stark example of that. This is one gentleman, this was published in the New England Journal of Medicine 8 years ago or so. This is called unilateral dermatoheliosis. So he was a truck driver for 28 years and had UVA damage through the window, just essentially on the left side. And you can see the effects of the UVA where it breaks down collagen, elastic tissue in the skin, and you start to age much more quickly on that side as opposed to the essentially unexposed side. So the UVA has a large effect on the aging of our skin. For the other science nerds in the room, I just wanted to show what we see under the microscope when we talk about sun damage. It's this bluish, purplish stuff called solar elastosis. It's truly a breakdown of the collagen in your skin. You lose that firmness and the collagen sort of plumpness of the skin. It truly gets degraded by the sun, and even the top layer of the skin gets thinned out with a lot of sun exposure. These are some other very common signs of sun damage we see. On the left are telangiectasias, broken blood vessels in the skin that become much more apparent as the collagen in the skin breaks down. In the middle are solar lentigines. These are sunspots, very, very common on the face, back of the hands, chronic sun-exposed areas. On the right is, it's officially called cutis rhomboidalis nuchae, but it's basically a rubbery, leathery texture to the skin that occurs with years and years of chronic sun damage. Some more images here. On the left is called Favre-Recouchet syndrome. It's basically acne, comedones in an area that has had a lot of sun damage. And on the right is poikiloderma of Savant. Sorry, I had a technical difficulty there. And that's that redness and beadiness to the neck, again, after years and years of chronic sun damage. Obviously, of major concern with chronic sun damage are skin cancers. And this is what I deal with very directly in practice as a Mohs surgeon. People who have had either short bursts of high intensity UV or chronic exposure to UV radiation without protection are at very high risk of making skin cancers. So there's a basal cell carcinoma on the left, squamous cell carcinoma with the scale and the crusting there. This is a Merkel cell carcinoma, which is a rarer type of skin cancer, but more aggressive on the bottom, and then a melanoma on the cheek on the right there. Background of skin cancers, most common type of cancer in the world are non-melanoma skin cancers. Over 5 million cases estimated in the US alone per year. So dermatologists will say that skin cancer is a public health epidemic, and it really is. It is accelerating. We're diagnosing more and more of them. People are engaging in risky behaviors with UV exposure and not protecting themselves. And so we're seeing rates go up, both in melanoma and non-melanoma skin cancers. Did just want to put in a quick plug against indoor tanning here. The bulbs contain as much UVB as natural sunlight, but far greater amounts of UVA. The idea being to induce tanning, but what that does is accelerates the aging of the skin very significantly. And then, like I said, suppresses the immune system locally, which makes you more susceptible to making skin cancers. Some people will say that they want to use a tanning bed before they go on vacation. They think it's protective. It is not. It actually doesn't increase the threshold needed to burn your skin. So it doesn't actually have the effect that you're shooting for. And then hopefully this is well-known knowledge at this point, but data has been very conclusive, and the National Institutes of Health has come out and said that sunbeds are a carcinogen in the same way that tobacco smoking is and other well-known causes of cancer. All right, so let's talk about protection. So again, just to set some terminology here, the efficacy of sunscreens is measured as SPF. Everybody has heard what SPF is, but that's sun protection factor. And this is a measure of how much UV radiation is needed to produce a sunburn on an area of protected skin versus unprotected skin. And it's calculated in such a way that the lower the SPF, each time you increase the number, it's a higher added benefit. And so once you start to get to around SPF 30, SPF 50, it's sort of diminishing returns in terms of the SPF going up, but you do get more protection with a higher SPF. It's just less and less added protection. When a bottle or a sunscreen says broad spectrum, that means it protects against both UVA and UVB, both of which are known to contribute to sun cancer or skin cancer and photoaging. It's extremely common that we do not put enough sunscreen on. So when the FDA tests sunscreen, they're basically using 1 ounce or enough to fill a shot glass to cover all exposed surfaces on the skin. As a general rule, most of the public applies too little, and so the actual applied SPF is less than half typically of what's on the label. So when we're encouraging SPF 30, SPF 50, what most people are really getting is SPF 15 or 25 because they're just not putting enough on. All right, and some are water resistant. That means they maintain their SPF after 40 to 80 minutes in water, but there is no such thing as waterproof sunscreen. And it's important to know that just by wiping off with a towel after water immersion, that removes almost all of the sunscreen. So it's really important to reapply even with a water resistant sunscreen. And then it doesn't matter what brand you use, what kind it is, the effects wear off after a few hours. The curve is, the efficacy starts to wear off after 2 or 3 hours. So this is a nice graph from the American Academy of Dermatology. It talks about the two main types of sunscreen. There are physical blockers and there are chemical sunscreens. The new terminology for that is inorganic sunscreen for the physical blockers and organic sunscreen for the chemical sunscreens. The physical blockers, we'll talk about those first. They really do block and they scatter the UV and the visible light. And the two main ingredients are zinc oxide and titanium oxide for those. The advantage of that is they're less irritating to sensitive skin. Some people develop contact allergies to the organic sunscreens, the chemicals. And so if they use these zinc oxide and titanium oxide based sunscreens, they're able to tolerate them much well. They're immediately effective. The main downside is sometimes they leave, a whitish film. A lot of that has been improved over the past several years as they've sort of microionized the zinc and the titanium, still with good efficacy, but with much more acceptable cosmetic outcomes. The chemical sunscreens, these are typically your sprays, but a lot of even the creams will incorporate a chemical sunscreen as well. So it's important to look at the label if you're going to be using sunscreen. These absorb the light and re-emit the energy. They absorb the photons from the UV radiation and then re-emit the energy. Multiple different kinds of active ingredients for those. They're typically not as messy and easier to apply, but again, folks are more likely to develop a sensitivity to them. This is another graph, or another nice picture from the American Academy of Dermatology. Just hitting home some of the key points is to use SPF at least 30 or higher. Again, in part because we oftentimes, the actual applied SPF that we're getting is significantly lower than that, so we want to start off higher. We want to use a broad spectrum because both UVA and UVB contribute to skin cancer and photoaging, and then water resistant plus or minus depending on what you'll be doing. And then again, using 1 ounce of sunscreen to cover exposed areas of the body. I often get asked by patients, and Melanie will be able to speak to this as well, but which one should I use? Just tell me which one to get. And there's no uniform answer to that. What I can tell you is it has to meet these criteria. It has to be broad spectrum, it has to be SPF at least 30, and then I don't want it to cause a reaction on your skin. But basically, I want you to pick one that you will actually use. The one that you are comfortable with, that you enjoy, the smell, the texture, whatever it is, find one that you like and use it. And that's the right one for you. I just want to make sure that you are actually using the sunscreen. This was a little tip for the golfers in the room, and for folks who have a big part in the hair, tennis players, baseball players, people who can't or don't want to use have that greasy texture to it. These powders are actually really nice. Because you don't have to worry about, say, in the hair, the grease sort of getting gooped up there. You don't have to worry about your grip if you're playing tennis or baseball or golf or whatever it is, if you use one of these powders. Again, I'm not endorsing the Color Science brand in particular. They happen to make one. There are a few other manufacturers who make a powder like this as well. So some key tips that I try to tell to all my patients is to make daily sunscreen just a habit, like brushing your teeth. You don't think about brushing your teeth in the morning, you just do it. So put this on your counter, put it next to your toothbrush, make it a part of your daily routine, and then you're much less likely to forget to have a base layer on at the beginning of the day. Reapply every couple of hours, 2 to 3 hours, especially after getting wet. And then please don't forget to use a lip balm that has SPF in it. The lower lip in particular is a really high risk area for developing skin cancer, in particular squamous cell carcinoma. And so I'd rather use a lip balm with SPF there than develop a skin cancer in that high risk area. Okay, so that's it for sunscreen. We'll go on to the other sort of major tenets of sun protection. So avoiding midday sun. The middle 4 to 6 hours of the day, the UVB intensity is much higher than in the early morning or the late afternoon. Roughly speaking, peak hours are about 10 a.m. to 4 p.m. And a really nice tip that I learned is if your shadow is shorter than you are, that's peak UV hours. So you want a tall shadow. You want your shadow to be taller than you are. And that's generally a lower UV intensity time of the day. Okay. Seeking shade is really important, especially during those peak UV hours. But even though you're in shade, like I said earlier, you're still exposed to about half of the UV out there, UVA out there. So wearing protective clothing, like we'll talk about soon, and the sunscreen, even if you're in shade, is still very important. People will say, I can't believe I got burned. It was a cloudy day. Clouds are actually very poor UV absorbers. They still let through 80 to 85% of the UV radiation. So don't count on clouds as shade. They do not count as shade. Tree shade can be very helpful, especially if it's a dense foliage type of tree and there's not a lot of wind. But synthetic shades offer more uniform protection, get you closer to that SPF 50. Again, I have some examples here. I know it's boat season out there. It's lake season here in Minnesota. Even though none of these folks happen to be in the shade of this picture, getting that shade up on the boat, on the pontoon, and trying to sit in it as much as you can does offer quite a bit of benefit. These are also very nice. A lot of manufacturers are making these canopies that pop up really nicely, and they have a UPF factor of 50 oftentimes. And so that's equivalent to having an SPF 50 sunscreen on while you're under those. So that's a really nice option as well. Wearing sun protective clothing is the last key point that I'll make. So this is measured by ultraviolet protective factor, which is a clothing equivalent of SPF. But not all clothes are created equally in terms of this. So the synthetic ones, the polyesters, tend to work much, much better than the cottons of the world. Dry clothing does a better job of protecting than wet. Loose fitting clothing does better protecting than tight fitting clothing. And pre-wash clothing does a lot better as opposed to unwashed clothing in terms of protection from the sun. Kind of a shocking statistic that some people find hard to believe when I first tell them is that your average white cotton t-shirt only has a UPF of 7. So that's like wearing not much sunscreen, basically. And when it gets wet, it drops to UPF of 3, which is very minimal sun protection. So the nice thing nowadays is a lot of companies are starting to make clothes that have UPF specifically built into them. And that depends on how they weave the clothing, the type of material they use, and sometimes they will weave a protective either chemical or barrier into the clothing itself that doesn't wash out. So whether they get wet or not, no matter how many times you wash it, they retain their sun protection. I just put some examples there. Again, many companies are starting to do this. A local one is Coolabar, Columbia, Patagonia, Athleta. All these companies have their lines, recognizing how important this is. These are some nice images, again, from Coolabar that show that you can have very nice protection, but still get out there. Notice that sunglasses are an integral part of sun protection. A lot of people end up developing skin cancers along their eyelids and wearing sunglasses, again, because it can be hard to put sunscreen and sometimes dangerous if you get too close. Wearing sunglasses can help mitigate the effects there. So some tips for sun protection clothing: use clothes with a rating of UPF 50 or plus. Rash guards are great because, again, it doesn't matter if they get wet or not. You're not having to reapply sunscreen all the time, even after you towel off, all that stuff. Remember to use sunglasses and wide-brimmed hats because then you're covering your ears, especially for the guys out there. This is another high-risk area for making skin cancer. So as much shade as you can carry around with you, the better, okay? So just to hit home the key points: using sunscreen, avoiding the midday sun, seeking shade when possible, and using that sun protective clothing. So I just want to again reiterate, I'm not asking you or any of my patients to be hermits. I hit that home all the time. I want you to get out. I want you to enjoy your life. Some people after skin cancer, they just want to go indoors and hide. We're not saying that. We're just saying use your protection and you should be in good shape. Okay. Here are references I utilized for the presentation. I will say thank you, and I'll send it over to Melanie here for any additional specific information.
I'm just going to show you some of the products that we have here at our office that Dr. Schmitt had kind of shown for people who want to use an aero spray. I find that this is good for hairlines. A lot of people can spray this on their hair. I have 2 teenagers, and as you know, teenagers can be pretty, they like things very specifically. So I know my daughter, I tell her that she needs to put like on a lotion first to start. This is a sport that we have in a pump. And then she can kind of do her reapplying with a spray, making sure she rubs it in and is pretty thorough with it. So, you know, you can have for your kids and other people, you can kind of mix up kind of what you use to get that best protection. I have a 18-year-old son who plays baseball, and this is the only sunscreen he will use because he likes the dispenser. The rep told us at the very beginning that this dispenser is really popular with teenage kids, and she was right. I don't know exactly why, but he will only use this because the dispensary will not use a tube sunscreen. So this is a really good one too for sometimes with kids. Adults, a lot of people that ride bikes like this one too. It goes on really nice, but it is your sport and comes in a nice big tube for your whole entire body. We also have some really good facial sunscreens. These are by Elta MD. The red tops come in tint and the white tops are untinted. The tint is nice for people that kind of don't want that white sheen, or maybe have a little bit of a darker tanner skin type. And then we have the untinted as well. The Elta MD line has a lot of great sunscreens that are very elegant. People wear them. They, you know, can get these into their daily programs because it doesn't feel like they have a thick sunscreen on their skin. They also have a daily one that has a little moisture, so you can use this as your sunscreen moisturizer. We don't recommend that people typically use a moisturizer with sunscreen in it because usually the SPF isn't high enough for protection. But if you can get a sunscreen that is a little bit more moisturizing with a higher SPF, then that usually is adequate enough. And the Elta MD Daily is a sunscreen that has a little bit more moisturizers in it. So that's good for a lot of people in Minnesota, especially in the wintertime when we're a little bit more dry. This is a good one to have right by your toothbrush that you can put on every day. The other one that's really unique, a unique product that Dr. Schmitt showed, was the Color Science powder sunscreen. There aren't a lot of companies that make this. So this one, you know, a lot of people, when they're trying to find it, Color Science is a good one to go to. You brush it on, you can put it, this is one of my favorites when I'm at baseball games. I start off with my Good Sport base, but this is a nice one that you can brush on very quickly, even while you're just sitting in a chair. I put it on my décolleté, my face, my hands, my neck, and then as my kids are running by, I try to get it on them as well. So this is a really nice one to do kind of your reapplication. Can't really see it on your skin. A lot of men think that it's kind of makeup-y because it's a powder, but it's not makeup. It's just a very nice powder that's nice to reapply. So that is a unique product that is really a great one. Color Science also has a kind of we call it a Tint de Soleil. It's more of a foundation type sunscreen, but it has adequate protection. It's a SPF 30 broad spectrum, but this is a good one for somebody who maybe wants that 2 steps in one. You get your foundation and your sunscreen all together and gives you a little bit of moisture. It's a great feeling product. Feels really light on your skin, but you get a little bit of coverage to even out some redness that you may have or cover some acne, papules and things like that. So this is a nice alternative too. And we have another one that is more of what we call a kind of your BB cream or your all-in-one. It's a sunscreen, but it has some moisture in it and coverage. This is by Revision. It's a called IntelliShade Original, one of our most popular selling products for a lot of women who want to just kind of do one step. So it's kind of your makeup, moisturizer, and sunscreen all in one, and does have adequate protection as well. So those are just a couple of your favorites. We like to have people really love the sunscreen that they have, so they'll wear it every day. So a lot of times we'll give out samples. We'll have people, our patients try many different ones to get the exact one that they will wear. And then, so we all are wearing something every day. Thank you for listening. I think Dr. Schmitt did a great job on being real thorough with all the information. So if you want to stop in our office, we are open to sell products, and we can help you at the front desk find the perfect sunscreen for you.
Thank you, Melanie. I'm going to see if I can find if there are any questions. Let's see. Let's see the chat section. Okay. So, go to full screen. I'll get rid of the PowerPoint. Okay, sorry about that. I think that we had somebody asking if we could go to full screen and get rid of the PowerPoint so we could see the products better. Hopefully if you go back to watch this, you'll be able to get in closer. And then Melanie went through and said the names of all these products. And then, okay. All right, and then we have another one that we will address offline at a later date. We have another question. Is it wise to use sunscreen with SPF 100? Very rarely do I recommend that people seek out SPF 100. Typically that's for our folks who have an accelerated rate of skin cancers. So oftentimes those are our transplant folks. So people who have had a solid organ transplant and their immune system is suppressed have a significantly increased risk of skin cancer, about 70 times greater for squamous cell carcinoma alone. So for those folks, we will say, maybe for you that little extra benefit from going SPF 100 would be worth it. But typically once you're in the 50 range, you're getting a very good amount of coverage. You certainly can go higher, but like I said, it's diminishing returns afterwards. So I always tell folks at least SPF 30 to 50 is kind of your sweet spot. And then you can go above that. You're just getting, little bits of extra benefit. But for some folks, that's worth it. So that's a really good question. Let's see if there are other questions out there. Let's see. No other open questions that I can see. Now's your chance to either type in something or send it via the Q&A box. I thank everybody for joining. I know that a lot of this is common sense, but it's good to hear specific tips, strategies that dermatologists like to share in terms of protecting yourself against harmful UV rays. Again, I want to emphasize, I want you to get out. I want you to enjoy the summer, get on the lake, do all that stuff, but just be really good with your sun protection and you'll be in good shape, and certainly come in if you have any specific questions, even if it's about products, like Melanie said, they're happy to discuss different products with you at the front desks of our offices here. And then certainly if you have specific spots of concern, things that are growing, things that are changing in size, shape, or color, come in and see a dermatologist and get it looked at. We're happy to do that at any time. But thank you all again for joining. I hope that was helpful. Oh, okay. Sorry, last question. What about getting vitamin D? This is another common question. So in the world of dermatology, we believe that the risks of burning, which is induced by UVB, which is the same wavelength that that causes that initial transition of vitamin D in your body is not worth the effects. You know, there have been really great studies that have shown that even people who are extremely diligent with their photo protection still tend to get enough vitamin D. And you can do that either by supplements. I think 600 international units a day is considered the standard amount, or via your diet. But the risks of having sunburns tend to, in our world, outweigh the potential benefit. It's certainly not worthwhile to go to a tanning bed to try to get that vitamin D. And we can, in terms of, we have another question here, providing a list of products shown and prices to the participants today. I believe would be able to send that out. Otherwise, like I said, feel free to come in. We are always masked here, with my exception right now, because I'm speaking to you. But we are taking all precautions here, and happy to talk about any products with you. Okay. If there are no other questions, I will sign off. Thank you all again. Be well, stay healthy, have a great 4th of July weekend. Okay, take care.